Hello guys and Assalamu alaikum. Welcome to Revised Pathology once again. In the previous video we discussed about AML and today we are going to discuss about CML. So as per I have seen the comments there in the previous video and there are people who are giving very good response in their comments. That means I'm very you people are watching my videos. So first of all I'm very thankful to all of you guys and so keep watching my videos, like them and share them as well as subscribe to my YouTube channel Revised Pathology. So let's continue with the topic CML. CML, the full form of CML is chronic myeloid leukemia. So its short form is CML. So it's a type of blood cancer. Okay guys, it's a type of blood cancer. Next, we have been discussing about all the other types of blood cancers and we even discussed about AML, which is also a type of blood cancer, and now it's CML. This is also a type of blood cancer. Now, next, we will see what is it basically. It is a myeloproliferative disease. So, myeloproliferative disease. That means it comes under the classification of under WHO classification in myeloproliferative division, as well as if you pick up in the classification according to the cell, it comes in the myeloid cell category or classification. I made a short video over it, as well as I have explained it in detail, all the classification of the leukemia. Next, so basically it's a myeloproliferative disease. We all have to remember this thing. It's a myeloproliferative disease. Next, let's see its etiology. Etiology is it's also called as what's the cause or causes. So for understanding, let me write even causes. What is the cause? Etiology or causes. So these are the things. What are the etiology and the causes? So the first and the only causes, it's a very important, and this is the only diagnostic feature with which somewhere we will be able to identify that the person is suffering from this sort of blood cancer. This sort of blood cancer, there is a chronic myeloid leukemia, okay, or the CML. So, what are the cause? Is the translocation within 9th and 22nd chromosome that forms Philadelphia chromosome. This is the very important diagnostic feature in CML, Philadelphia chromosome. One of the main features there, the formation of Philadelphia chromosome, which is one of the cause of CML. All right. Next, let's even see in what is the age in which it can occur. Incidence. It can occur within third to fourth decade of life, whether male or female, both. I'm sorry for the spelling. Whether male or female, it occurs in third to fourth decade of life. All right. Next, do you know, guys? CML even occurs in children. It can even occur in kids, and we call it as juvenile CML. It's a very important thing for you guys to understand it. That's a second variant. That's a variant in kids. In children, called as juvenile CML. Okay, this is very important for you guys. But mostly we will be discussing about the CML today, which is only in or which only occurs in third to fourth decade of life. Okay, that means in adults. We will be discussing this CML, and that is what we are discussing, in which Philadelphia chromosome will be also found. Okay, so now let's come to the clinical features. So the first clinical feature is anemia. The second one is gout. Third, visual disturbance. Next, you'll find in them splenomegaly, that is enlargement of spleen, as well as hepatomegaly, that's enlargement of liver. So, what are the clinical features, guys? Anemia, gout, visual disturbance, splenomegaly, as well as hepatomegaly. You can even write hyperuricemia, because once there's gout, that means there is an increase in uric acid formation. Okay, so that's why gout is being formed here. Okay, so you guys have to remember these things very well. And the next heading, which is very important to identify whether it is CML or not, or whether the particular person is suffering from CML or not, from this type of leukemia or from this type of blood cancer, we have to know the lab findings. What are the what the lab findings will be in CML. Lab findings. So the first lab finding we will see, as per what we said, we take a smear, blood smear, and we call it as pathologically the blood pick or blood picture. What are the things that the blood will show? Okay, so it will it will first of all show anemia. But what sort of anemia? It will show us normocytic, normochromic anemia. Next, we'll see what will happen to WBCs. There will be leukocytosis in them, increase in WBCs. Next, the number of platelets either will be normal or raised. or increased. Now we will see what about the bone marrow. First of all, we will see the cellularity. So if we talk about the cellularity, it will be hypercellular. We will talk about the myeloid cells. There will be an increase in erythroid myeloid ratio. Third, we'll see about the erythropoiesis. Erythropoiesis will be decreased. That means reduction in the formation of RBC. Okay, so cellularity is hypercellular, myeloid cells, there will be increase in erythroid myeloid ratio, and erythropoiesis will be decreased. If we talk about the blood picture, we will see there will be normocytic normochromic anemia. WBCs will show leukocytosis, that means increase in WBCs, and platelets will be either normal or increased. Next, the last point that was cytogenetics. There's one more, there are two more points, that's it, which comes under the heading of lab findings. Cytogenetics. Cytogenetics will show presence of Philadelphia chromosome, which is said before, which is one of the most important diagnostic feature, all right, in CML or of CML. Fine. So, what is the presence of Phil Philadelphia chromosome? And if we go towards other investigations, we'll find there will be hyperuricemia, guys, I'm sorry about the spelling. Hyperuricemia, that means increase in urea levels, or uric acid levels. I'm really sorry. You're really sorry. Sorry. Increase in uric acid levels. Next, you will find increase in vitamin B12 and vitamin B12 binding capacities. That's it. So, these are all the things you will find in CML, and that's all for today. And the next topic will be on, inshallah, ALL. Guys, please write it down in the comments what ALL is. What is the full form, not what ALL is, that I will tell you. What is the full form of ALL? And so, keep smiling and subscribe to my YouTube channel, like my videos, and share them. And what's the name of my channel? Is Revised Pathology. Subscribe it. Thank you so much. Allah Hafiz. Bye bye. Keep smiling.